Welcome to Maryland Medicine Frontline News. It's truly an historic time, with vaccinations underway for healthcare workers nationwide and at the University of Maryland, including frontline faculty, physicians, nurses, and therapists. Within hours of the arrival of the first shipment of the Pfizer vaccine, the first dose was given to Sean Hendricks.
I am a nurse by profession, so I trust the science behind it. I am more than willing and happy to get the vaccination because I know what it's going to mean, not just for me, but people of color. We have been stricken 3 times more than any other ethnic group, so it's very important, not just for me, but anybody that's going to follow behind me.
Respiratory therapist Daisy Solares was grateful to be vaccinated after watching patients die from COVID-19 and after losing a family member.
I've taken care of COVID patients at the beginning. However, my father ended up getting the virus and unfortunately passed away. So it means a lot. Basically in honor of him.
I hope this vaccine will be the way we get back to doing all the things that we miss doing, seeing our loved ones regularly, without fear, without concern for either making them sick or for our getting sick and not being available to do the job that we're needed to do.
Vaccinations are taking place in an auditorium at the University of Maryland Medical Center, which allows for social distancing as employees wait their turn to be vaccinated. Employees are escorted through a check-in process before receiving the first of 2 doses.
We have currently about 17,000 individuals at the medical center who need to be vaccinated. We're doing the frontline folks who are providing patient care first, but we're going to move our way through the entire employee population.
After her vaccination, respiratory therapist Lucia Barlip felt relieved and positive about the future.
It's probably the biggest thing in my entire lifetime. I would have never thought I'd experience a pandemic, much less be one of the first vaccinated in the state. So it's a pretty big deal, and it's awesome. I feel great.
The vaccine is prepared on site, but because the Pfizer vaccine is stored in ultra-cold freezers, it's first brought to room temperature.
Before the vaccine is diluted, we will invert the vial 10 times. We will add the diluent to the vial. We inspect to make sure that there's no particles in the vaccine. And then we will draw up the specific doses, which is a 0.3 ml dose.
For many, the vaccine signaled the beginning of the end of the pandemic.
It's a time for us all to come together as a world, and vaccines developed, and we have to think of each other, and I think we are doing it, and I think we will get through it together.
We all should be extremely proud of this moment. In so many ways, it's the culmination of months of tireless work by our incident command system, our faculty, researchers, laboratory workers, and others on the front line of research and patient care. Indeed, they have given us all a great gift, for which we will be forever grateful. I'd like to extend my deep appreciation for everything each of you has done to make this year an extraordinary success, despite the many challenges. Please accept my most sincere wishes for a safe, happy, and healthy holiday season. We can all be hopeful for brighter days and even greater achievements in the year to come.
With the Pfizer and Moderna vaccines approved by the FDA and the Novavax vaccine trial moving forward at the University of Maryland, the Institute of Human Virology continues to explore vaccine strategies under the leadership of Dr. Robert Gallo.
Is looking for perfection in a COVID vaccine something that's going to be detrimental to this ultimate goal of herd immunity?
I don't bank on herd immunity. A lot of people talk about it, but you don't know you're going to get it. And to answer your question, I think you do as best you can with the vaccine, and it looks to me like they've done pretty well with the messenger RNA vaccines, and it's rather exciting, the percent of efficacy that they have achieved in this preliminary study.
The IHV is also developing therapeutics to treat people with severe COVID-19.
One of these studies that we actually did was a molecule called CD24, and that's a molecule was developed by Drs. Yang Liu and Dr. Pan Zhang, both of them professors at the Institute of Human Virology and the University of Maryland and the Greenbaum Cancer Center. The CD24 FC molecule is bind to T cells, and it helps T cells to not produce a lot of cytokines. And we believe that that's one of the reasons why people with COVID-19 will get severe pneumonia and then end up in ventilator. So that's what the mechanism that will prevent T cell activation, and that will lead to people having not so much inflammatory response and not getting severely sick when they develop serious COVID-19 infections.
Dr. Kodalil was recently awarded mastership in the American College of Physicians. He says the goal is to keep people with COVID out of the hospital, and if they are admitted, to get them home sooner. That's Frontline News. I'm Larry Roberts. I hope you'll join us again next time as the fight against COVID-19 continues.